This study is about the use of digital communication, so that's using mobile phone, text, email, between young people with a long-term health condition and their clinical team. And the long-term health conditions could be diabetes, sickle cell, cystic fibrosis, mental health problems, liver or kidney disease, cancer, anything where the health condition goes on for quite a long time and the young people build up a relationship with their clinical team. We became aware that there were clinical teams all around the UK who were beginning to use digital communication with their young patients, but they were doing it in a very ad hoc way. And we wanted to look at how these innovators were developing this service so that other people could actually learn from it. We were also aware that there was a new infrastructure coming into the NHS so that digital communication between clinicians and their patients would become easier. And the government policy is very much towards encouraging clinicians to go digital. We studied 20 different clinical teams who were providing this digital access for their young people. And they were doing it in lots of different ways. Some of them were using email, mobile phone, some text. And what we found was that they had worked out which channel of communication worked best for which type of problem. So mobile phones are great if it's really urgent or if there needs to be some discussion. And mobile phones were much better than landlines because young people could spend a long time trying to find somebody using a landline, having to go through the switchboard of the hospital, etc. Emails. The young people liked to use the emails when they wanted to think about what they wanted to say. Equally, the health professionals also like to use email when they wanted to just ponder, maybe look something up before they communicated with the young person. And text message was great for doing things like, I've just been sick, how do I change my insulin dose, or I've got this side effect of a tablet, do I stop the tablets? And for the health professionals to send reminders or just text to say, are you doing okay, do you want to talk? In which case they could then have a phone conversation. One young person living with cancer told us how he wanted to email his health professional before he saw him because he actually wanted to bring up the issue of dying. He was aware that his cancer was recurred and he wanted to talk about this, but knew that in a face-to-face consultation he wouldn't be brave enough to say that that's what he wanted to talk about. So he emailed his clinician so that he knew that when they met, that the clinician would bring it up. This uses digital technology that is around. It's not that there's got to be something new invented for this. It is using what's already around. And as more and more people are becoming very sophisticated in their use of digital communication, there's no reason why this type of access shouldn't be available for older people living with long-term conditions.